Addressing your child's mental health during an already stressful time. Child and youth therapist Tanya De Silva joining us today with some tips and how to spot some signs as well. Thank you so much, Tanya, for joining us today.
Thanks for having me back.
So, we've been in this pandemic for more than a year now. What are some of the issues that you've been seeing when it comes to children and youth and their mental health?
We're definitely seeing an increase. The amount of phone calls we've been getting lately just continues to double. And the things that we're hearing is kids are struggling a lot with anxiety, with depression, with just feeling insecure and not really knowing how to handle the day-to-day challenges of what the pandemic brings. Another big one that we're noticing is just even the struggles with relationships, how to continue navigating those social interactions. And one that is pretty concerning is we're seeing a lot of calls about eating disorders and substance abuse, and that's been one that's really spiked over the last couple months.
Now, further to that, can you expand on that a little bit more now? And even, I believe you mentioned sleep being an issue as well.
Yeah, so we're seeing it a lot with our kids, and something that we always mention is for a lot of these kids, they might have potentially already been struggling with substance or with eating disorders or just poor coping strategies like, poor sleep or eating. And because now we're in a pandemic where we are very isolated, there's just less opportunity for us to notice that these kids were struggling. So it's been going on longer, and obviously it's been getting worse. So for some of our kids, they're on that side of it where they were struggling already before and it just got worse during the pandemic. And then there's the other side of it where for some kids, they have been trying to cope and they've lacked those positive coping strategies. So they've started turning to things like controlling their eating or playing around with substance abuse. And what we keep hearing is they're like, you know what, if I can't control what's happening on the outside world, well, I can control what I'm putting into my body. Or if I can't control the outside factors that are impacting my mood, well, taking this substance will alter my mood for a little bit. So they're looking for ways to feel a sense of control in a world that we're all lacking a lot of that.
And now, what are some of the signs parents can spot for when it comes to addressing these issues?
I think some of the more obvious ones, we always talk about them as clues, but sometimes parents are like, I'm noticing the scales out a lot more, or, I found that they're a lot more secretive or taking their backpack with them everywhere. So sometimes there are clues that start sparking that, but typically we look at, changes in mood overall, changes in habits, in behaviors. They're isolating a lot more. That secrecy is a big one, especially if they are struggling with eating disorders or with substance abuse. That is something that they're going to try and hide and kind of keep out of the public eye or out of their parents' eye. So looking for things like that.
And if parents are noticing some signs like this, what are some tips in terms of really initiating and starting that conversation with their child or teen?
Well, I think just being very honest about what we're going through. Like, this has been a really hard year for everybody. So I think validating the fact that, you are probably feeling this way and it's okay to feel this way. And I know sometimes parents struggle with, they don't want to okay the decisions that they're making or the coping strategies that they're using, but you can still validate that I can see why you're struggling and why you're potentially looking for outlets like this, but there's healthier options for us. So really validating it and then moving it into what can we do? So how can we cope? And I find for parents, especially because we're all spending so much time together, modeling some of those. So, modeling ways that they can practice, healthy sleeping habits or getting outside or taking care of their body in different ways. And that starts showing it at home and even making it a family affair where we're doing this together. It creates that sense of connection, which we're all really lacking right now in this current climate anyway.
Yeah, it's definitely been a very difficult year. Tanya, any final advice or tips for families watching out there this evening?
So something that I always stress is even trying to look at this as a non-negotiable. So we make sure that our kids are seeing a dentist or seeing a doctor regularly because we want to make sure that their body is where it needs to be. We really need to start doing that with their mind as well, where, it's not a choice in terms of if you're going to see a therapist, but we want to give them that choice factor and let them know that you can choose who you see and you can be part of the process. And like I said earlier, making it a family affair where we're all going to start seeing a therapist together, or I'm working with my own as well. It's again modeling that we do need that, and it is something that we're all going to benefit from, and this is how.
Okay, an important conversation to have with kids and teens out there as well. Tanya, appreciate your time. Thank you very much for joining us today.
Thanks for having me.